Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer at the University of Kansas Health System. We're coming to you live from the Dolph Simons Jr. Family Broadcast Studio today on Open Mics, Life After Incarceration.
You're alone sometimes. You fall into these crowds where you feel like you love, but at the end of the day, when you locked in behind them bars, you can't call them people.
Support. It's critical for women in the criminal legal system. But how can we provide the social support they need? Today, you'll meet the local team empowering women to take control of their health, including their sexual health. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. Those links are right here on your screen. Sexual health empowerment, otherwise known as the S.H.E study, here in Kansas City, works with women to improve sexual health outcomes both during and after incarceration, focusing on themes of love, gender, social support, and community life. Our guests today include Project Director and Investigator Joi Wickliffe. How close was I?
That was great.
Awesome. And Sierra Stites. How close was I on that?
I mean,
not bad?
Close
okay,
enough.
Good. A research associate with the Department of Population Health, who also happens to be my daughter. And fortunately, she looks more like her mom. Tell us about your work, Joi, with the Sexual Health Empowerment Team in the Department of Population Health. How did this project begin?
Well, the project began by noticing that women who have been incarcerated are 4 to 5 times more likely to have a cervical cancer diagnosis. And with that, our principal investigator found that some of that has to do with cervical health literacy. And so we operationalized cervical health literacy as knowledge, beliefs, self-efficacy, and confidence navigating the systems. And so we developed the Sexual Health Empowerment Project, which is a 5-day cervical cancer literacy and prevention program.
You know, that's a big deal. 4 to 5 times greater risk of cervical cancer. Is that because they were incarcerated, or is it because their life choices are different?
That's a really good question. So when people leave jail or prison, there are issues that they have to face that are a little bit different than other people. So one of those examples is trying to find an ID. It's costly to get an ID, especially when you don't know where your birth certificate is. You have to apply for your birth certificate. You have to apply for your social security card. And so there are just different things that they have to consider before they even attempt to get a job. So that's a starting point. So they don't have jobs. They're unable to get stable housing, especially if there's a drug charge. They don't apply, or they're not eligible for housing, and just things like that, just the day-to-day things that some people may not have to think about. Getting up and taking the bus to go to an appointment, getting up and trying to figure out childcare. If you don't have stable housing, how do you do that? If you don't have your identification, how do you do that? So those are just some of the examples.
You know, that's got to be really difficult. I can't even get my real ID driver's license figured out. I can't imagine how people who don't have resources can even navigate so much of our social network. Sierra, we just saw a clip of the documentary. I think you helped make that. Tell us about the women and why you decided to create the video and include her.
So the reason we wanted to create a documentary is that we wanted to create something that was really accessible to everyone to engage with these incredible stories that Joi and I get to hear every day. As researchers, and as people here at the University of Kansas Health System and the University of Kansas Medical Center, the primary way, before the Medical News Network and Open Mics with Dr. Stites, the primary way we share information is by writing papers. So we go out and we do this research, and then we write it up in a research paper that is full of medical jargon, terms that folks aren't usually used to reading, and then we publish these articles in journals that are sometimes have paywalls that aren't super accessible to the general population. And so folks just don't get to hear the amazing stories that Joi and I get to hear from the amazing women that we work with. And these are stories of strength, they're stories of resilience, they're stories of being daughters, they're stories of being mothers and sisters, they're stories about your first period. I mean, they're stories that everybody can relate to, and they're stories of common humanity that I think are really powerful. And this is the way that we make change for folks who are our neighbors, for folks who are our friends. And so we wanted to create the documentary in order to change the narrative around folks who've experienced incarceration for their families, for these individuals, and ultimately to advance their health.
You know, that is beautifully stated. And I just got to say, I think it sheds such a different light on how people should be looking at those who have been incarcerated, because prison is not a choice sometimes, and it is such a difficult role. Joi, what are some of the characteristics of these women that you'd like to highlight?
Well, first of all, they have more strength than I could ever imagine. They're able to figure out a way, and you know, I get like very anxious sometimes when I don't remember like an assignment for work or a task for work, but they're getting up from a shelter, they're figuring out how to get to a job interview, they're trying to figure out how to feed themselves, they're figuring out which local social service is open on that day so that they can try to get a case manager. And so I think one thing to highlight is their strength, and that should come first. And then down the list comes their incarceration history. They're strong, they're mothers, they have personalities. You know, we're the same in a sense.
Yeah, I'm reminded of the Scarlet Letter, of the story of Jean Valjean, and how even after you may leave structural prison, you're still in social prison because it stays with you. What is important about folks being able to share their own stories here?
I think you're exactly right. One thing, a woman that Joi and I had the pleasure of speaking with, we got to go to her house, and she collects clocks. So she has these beautiful antique clocks that are in her room, in her home. And one thing she said to us is, you know, once I've done my time, I'm still doing time. And what that means is, you know, she served her sentence, and then she gets out, and she still has that scarlet letter. She still has that yellow piece of paper, metaphorical, that says, you know, I've been incarcerated and I have this stigma attached to me that means I can't get a job, I can't access certain social services. In some cases, you're not allowed to vote in some states. I mean, it just makes life so much harder, even after you've paid back your debt to society. And so, I'm sorry, I forgot your original question.
No, I think you've just answered it, because it is. And how do you share all those stories, and how can these people share their stories? Because they're beautiful stories, but it's hard for them to share. It's hard for folks to share that story when, even though they've left the prison, they're still incarcerated in some ways.
So I think it's up to folks who have privilege and who have power like us to provide that platform and then to step back. And that's what Joi and I are trying to do today, and trying to do with this documentary, is share the stories, bring the women together. We paid them for their time. We pay them for their time when we're doing the research, and we paid them to come and share their stories in this documentary setting. And then we are sharing this documentary. We put it on YouTube. We are sending the link out. We are presenting it at conferences and in community settings across Kansas City. And then the women have the opportunity as well to share it on their social media platforms, which is great. You know, it's a really empowering way to take control of your own narrative when somebody else has been controlling it for so long.
You know
Dr.
what?
I'm
Please,
sorry, excuse me. If I may, I just wanted to add on to what Sierra was saying about the sharing of stories. We're also able to share our stories as well. It's a lot of common story telling here. And there are a lot of things that we can identify with. We've been heartbroken, we've cried, we've lost employment, all of those things we're able to share with the women. And so it shows that humanity, and sometimes these women that have these histories are often lost, as if they don't exist, as if they're not humans.
Yeah, life is complex. There are a lot of social circumstances you have to be aware of. Things like housing, stability, family, community support. You guys have really mentioned and hit on all those themes. How does this guide how does this guide your work that you're trying to do?
Oh, that's such a tough question, and I think it comes down to love. love guides so much of what we do, and it's love and respect. We have a lot of love and respect on our team. We show a lot of love and respect to each other, and we show a lot of love and respect to the women that we work with, within what is appropriate and deemed appropriate by the IRB, the Institutional Review Board. And coming from that place, recognizing that at the end of the day, we are all people who all have a lot of stuff in our past that we're currently dealing with, and who are all, just trying to get through the day. And like Joi said, there's so much that brings us together. There's more that brings us together than what breaks us apart. I think it's a lot of the same themes that you've been talking about on the show with COVID. There's so much more that unites us than divides us. And I think that's what we try to remember in the work that we do. I know I mentioned sharing the story of your first period. Every person with a uterus has a period.
It's scary for all of us.
And it's scary for all of us. And that first time telling that story, there's so many laughs and moments of joy and curiosity and talking about how your dad handled it, or didn't. It's always just these threads of humanity that are so beautiful and important.
Yeah, which color of this am I supposed to pick up here at CVS? I haven't done that aisle.
With the wings.
Literally.
Get the one with the wings.
Yeah, that's
right.
The one in the aisle at CVS. Okay. There's a lot of sexual health information out there right now for younger women, but not for adult women, Joi. How can we target and educate this group?
Well, I think we have to begin with understanding that just because someone is an adult, we can't assume that they know everything there is to know about their sexual health. The questions that we get asked sometimes are very mind-blowing, like things like, so how exactly do you get pregnant? People understand sex, like the activity of sex, but they don't really understand what the sperm does and what the ovaries do and all of those things. And so I think that it's important that we focus on adult women, because it is an assumption that only kids need this information. And so with women that have been incarcerated, it provided us a unique opportunity to reach a whole bunch of women at one time. We were able to go into the jails and deliver this simple information. Here's what it means when your physician says abnormal pap, or here's what a speculum is, or here's how it feels when you begin your period, and here's how you can talk to your daughters or your nieces about it.
And that, just because you turn 18 and you're 20 doesn't mean you know everything in the world, does it? And especially for these women who are challenged by their social circumstance.
Right.
Exactly, and it's the circumstances leading up to incarceration, it's the circumstances of incarceration itself, and it's the circumstances following incarceration.
So coming up, this work is growing, how their success is inspiring others to help women with life after incarceration. We want to get your questions first, so let's head to Studio B. Good morning, Jess.
Hey, Dr. Stites. Good morning. Glad to have Joi and Sierra on this morning. So great to have them.
Yeah,
and the first couple of questions are for them. Anne wants to know, how were the women selected for this particular study and documentary?
All right, who's taking that one on?
I'll take that question. Thank you for that, Anne. That's a great question. So we selected the women. First of all, we had to do a lot of bonding and convincing with the local jails. We took donuts and we put on our smiles.
See, donuts are always the
Y'all, it's
end.
the donuts.
Yeah,
Okay.
you win with donuts.
In moderation. So we went in and we were like, hey, we have this opportunity to do this health program. Can you please let us put up a flyer and see who shows up? And so the women sort of came to us. We tried to keep each group to 25, but over 2 years of the recruitment period, we got 264 women who enrolled, and then we were able to complete 182 of them. And so the eligibility was you were currently incarcerated in one of these local jails, and you provided your informed consent, and that was it.
It's impressive that these good folks trusted you with this story about their lives. And to be on camera that hard to be a hard choice for them. Roger, I'm sorry, go ahead. Jess.
Yeah. So Roger asked, Dr. Stites, So you mentioned support is so crucial for these women. How can we as a community overall help women leaving the criminal justice system?
What do you think?
So I think it starts with being a judgment-free zone. The line between being incarcerated and not is so very thin.
And inconsistent.
And inconsistent, right. Black folks are incarcerated, Black men are incarcerated at 5 times the rate as white men. Black women are incarcerated at twice the rate as white women, and the disparities just continue from there. And so as a community, it's important to advocate for just criminal legal policies, and it's also important to talk to your legislators about, like I said, just criminal legal policies, whether that's in housing. We have discriminatory legal policies in housing. The look-back period when you go to apply for housing is 5 years. And 95% of folks who are incarcerated return to the community, which means a lot of folks have criminal backgrounds, and if you can't access housing, you're going to go back to jail, and that process of recidivism is so difficult. And so there's lots of ways that you can advocate. Talk to your legislators. I know we have talked about that a lot on the show, but Joi, do you have anything else to add?
I think one way that we can help would be to, you sort of hit on it, Sierra, this fine line that we often tread. It is so easy to commit a crime that can take us to jail. And something as simple as forgetting that your license is suspended, and something as simple as riding along in a car with somebody that has drugs with them. Like, some things, it's just so, I don't want to say easy, but those are things to consider. So we're looking at a person and we say or see they've been to jail without really understanding all of that that went into that jail sentence. I was in college once with friends that were shoplifting from a store.
Yeah.
That could have been me.
Listen, I had people in my trunk in my car drinking. I mean,
all of that.
It's just when I was in high school. I mean, if the police had pulled us over, it could have been bad, right?
Mm-hmm.
And we're trying to get into a one of those outdoor movie theater shows things. What do they call them? Drive-ins. So.
And I think the other thing that's important to do is never ask somebody why they've been incarcerated. And that's something that can happen here at the health system when you are interviewing a patient, taking a social history. Just don't ask why they've been incarcerated. It's not important. And when you are meeting somebody and they share that they've been incarcerated, just don't ask the reason. It's just a way to show that you respect them as a person, that you share a common humanity, and are there for them as a person.
Jess?
Yeah, I have a couple of COVID questions this morning. Joellen wants to know the Omicron booster question that we get. I understand the new booster is not based on trials and data. What can you tell us and reassure us about its safety and how efficient it is?
Gosh, Hawk, every year we reconfigure the influenza vaccine. There's no trials around that. There's really no trials, but we understand the safety of it because the technology and the way it's been made and how your body reacts, that's the same.
Mm-hmm. Yeah, exactly. There have been trials just looking at the amounts of antibody titers, how high your antibodies get after some of these dosing. They've looked at the bivalent vaccine, but they've also looked at just using Omicron. So there are those studies out there. As far as the safety, I think most people are mostly concerned about that. The safety is going to be the same as with the original vaccine, so I don't think there's any issues there. Again, the major reason why that Committee on Immunization Practices said go ahead and put 2 spikes in the new vaccine, the original ancestral spike, but also now a BA4, or it's probably actually going to be a BA5. I think we're waiting to see, but I suspect it's a BA5, is because really it won't be harmful, and the benefit could be much greater than just the original one alone. But we know that the original vaccine alone works very well as well when you are up to date with that.
And an interesting point to be made here, Hawkeye. Let's say you got the original vaccine and then you got BA5. you sort of gave yourself a trial of the bivalent vaccine.
Absolutely.
And
Yep.
you're going to be okay. That's what we know. And billions of these vaccinations from the mRNA have been given worldwide. Incredibly safe vaccination.
Yep. And right now, just as an aside, we know that BA.5 continues to be the highest or most dominant circulating variant in the United States, and then BA.4 is second. So it's about 85% to about 15% or so.
So what's our count look like today, Hawk?
So right now, the COVID count, again, still higher than we would like it, but it is much lower than it has been. 20 active infections, 1 in the ICU, 0 on the ventilator, 17 in that recovery period, and overall the trends in the United States as far as recorded cases and hospitalizations continue to be downtrending. So I think overall that is good news as we head here into the fall.
Yeah, and we saw the heat map, I think, last week. We can see it again. It's gotten better. It's still got the stuff out in the southeast, in the mid Ohio Valley, that looks a little bit more red, and we're in Southern California. But some of the southwestern other parts of the United States have begun to diminish. So we're seeing it fade. We see the national numbers fading. I think that's all reassuring. The other thing just to point out, you can still flip between Pfizer and Moderna at any point, really. I don't think people should be too concerned about that. Your thoughts?
Yeah, no, I would agree. I think there's not much else to.
Most say?
Yeah.
Okay.
Yeah.
All right. And more questions and discussion ahead, but it's time to check in also about monkeypox. We know that there's now been at least 1 death reported in the U.S. I think it was in Texas, if I remember right.
Yeah, and we know there's been deaths around the world. Again, a very, very, very small death percentage. Those patients probably immune compromised. I think most of the deaths occurred in Portugal, maybe Spain. We have now had a death in the United States. There isn't much information about this other than the patient was immunocompromised. So I'm sure within the next couple days or 24, 48 hours, we'll have a little bit more information. Obviously, we want to protect patient confidentiality, but I'm sure there will be more information about that. But overall, I think that it is important to continue to recommend and endorse the Jynneos vaccine, especially if you are at high risk. We have seen a decrease in the trends of cases, so I think that is a good thing as well. But we are still giving the vaccine here at the health system. We have given just over 100 doses now, so I think we still have a good program going for that and have doses available. So if you are in that high-risk population, please contact us and get vaccinated.
So the other thing, that important articles that have come out in the last 24 hours, American life expectancy went from 79 to 76 years old. We haven't seen a drop like that in decades. I'm not even sure we've seen one like that. So, and that's just been over the time of the pandemic. So anybody who thought that COVID wasn't real, or anybody who still wants to go out there with QAnon and say that it really doesn't hurt you, it's not the average life expectancy is down significantly, Hawkeye, in just the last 2 years.
Yeah, I think across the nation that is true, but especially as we were talking about different populations, we know that in certain populations, minority populations, that is even more true as well because of the health disparities and overall underlying disparities for getting access to healthcare, preventive medicine, all of those things. That is a continued issue, will be a continued issue, and we'll certainly continue to work on it and have great speakers here talking about that in general today as well. So very important. But also we understand that not only life expectancy has decreased, but we also know that long COVID is quite significant, will continue to be a significant issue for some survivors as well, and that will be, it's anticipated that is going to be another one of the new health epidemics as well.
In fact, when I was out in the lobby this morning, a patient who I've seen in the past stopped me, and her daughter had COVID, and she was thanking us for the program, Hawkeye, but also saying that her daughter has the vasculopathy that comes about, means vascular changes from COVID, and she still struggles with some of the long-term side effects of that and some of the neurologic and rheumatologic changes. Yeah, COVID's real, it's still real, and we know how to stay safe from it. And the good news is, as we've talked about, the numbers are dropping around the country. Hey, let's get back to our guests. Their study is expanding. That's awesome. Tell us more about the studies being done now in California and Alabama.
Yes, so thank you, Dr. Stites. We've been So the S.H.E project began in 2014, and we followed up with those women for 3 years. And so we found that, you know, it's kind of difficult to just focus on Kansas City when we have other opportunities to see what's going on in states that have expanded Medicaid, for example, states that do have different criminal legal system policies. And so we thought it'd be a good idea to kind of compare and see what's going on here. And so we were able to use some resources to develop a partnership with Oakland, RTI Research, the Research Triangle in Oakland, and then we also developed a partnership with Birmingham at the University of Birmingham Medical Center. And so we now have 514 active women in the study. And it's interesting because some of the things we see here in Kansas City are not the same that we see in Oakland, for example. A lot of people in Oakland have access to medical care. And so some of those preventive screening services, you're seeing more of that versus here in Kansas City. In Birmingham, they have a different system where you can be incarcerated in the community. So there's kind of a community carceral system. You don't have to actually be on what's called house arrest as we know it, or actually in the jail. So we're finding some very interesting things, and we're getting excited to be able to share those data.
Well, I think that we'll look forward to hearing from that and get you back to talk a little bit about that. So Sierra, what's the role of public health and healthcare in making sure that the voices of folks who've been marginalized are heard?
So I think the biggest thing that we can do is to listen. And it starts by recognizing the harms that have been done historically in the United States since the founding of the United States, and even before that. We talk about the 1619 Project. So since 1619, when the first slave ships arrived, there's been a legacy of oppression and systems of racism in the United States, and we see those harms being played out today. Everywhere in our public health system, in our school system, in our healthcare system, and things have gotten better, but they're not good enough. And that's why, as Dr. Hawkinson said, we see disparities in COVID. We see disparities in incarceration rates. We've talked about the life expectancy, how the life expectancy has dropped since COVID, but in Wyandotte County versus Johnson County, so two counties that are right next to each other, the life expectancy difference is about 12 years, and it's even further apart for Black folks and white folks and Latinx folks and white folks, and that's something that we just can't accept. And so one thing that we can do is recognize those harms, and that's research that's being done at the University of Kansas Medical Center, and they're partnering with the health system to do that work. But something that we can do as folks who have privilege and who have power to change is to listen and to make sure that we are understanding the history that brought us here, and to make sure that we are working to change. And then when people are saying like, hey, this is what I need, whether it's transportation or help managing my medical expenses or help managing my care, I really could use a social worker to help understand how to get Medicaid in Missouri. We can help support that and help provide access to those services.
Yeah, and I think that's a great point. You know, we talk a lot, but I just remember even as an interracial couple, there are places where my wife, Sandy, your mom and I couldn't go, things we couldn't do, houses that people wouldn't show us when we tried to purchase those. I mean, the story goes on, and if you look at today, just around home buying, that an African-American couple will be charged, or much less likely to get the same house, even if they have the exact same credentials, and will have a higher interest rate than a white couple. And that's a type of things that when you just accept the facts on face value, then you have to recognize how it continues to permeate throughout society and how it does affect folks. Those are real challenges, I think. Joi, what's been the biggest lesson from the work?
The biggest lesson, Well, one thing we kind of spoke on it takes one decision to change your life forever, and that can be a bad decision, and we can be marked as having a criminal justice history, and that's it. It doesn't matter how smart we are, it doesn't matter how much education we've had, it doesn't matter. One decision, one drunken night of driving, one experience in a toxic relationship where you've had to defend yourself with a weapon. Like, anything can put that label on us. And so the biggest lesson for me would be to stop judging people. Just stop. We have to really realize that they're a human being first. All of that is secondary. They're a human. They have feelings. They have to make decisions that we have to make. And sometimes those decisions don't align well. But that's the reality of it. So I say that'd be my biggest lesson.
Yeah, that's a great point to be made. Jess, do we have other questions from our community today?
Questions for Joi and Sierra. Yen Liang wants to know, what could females who've been incarcerated do to get themselves prepared to head back out into society?
What do you guys think?
So the question was, what can women who have been incarcerated do to prepare themselves to head back into society? And I think there's a lot that we in society can do to receive women who've come back into our community. And I think one thing is to try and reduce the debt that women can accrue while they're being incarcerated. One thing I have learned during the work that I've done and the work that Joi and I do is that you have to pay a copay in Kansas when you go and receive care, and that copay can range from $2 to $5. But when you only make cents per day, that copay for someone in the free world, the equivalent is like $200. And so one thing that we can do is rethink copay policies.
So if a woman's incarcerated, if they get health care while incarcerated, they have a copay.
Indeed.
But they really have no means to make income. That's tough. And so that accumulates, especially if they have any health conditions, and they come out and they carry the debt.
They do.
Ouch, that's tough.
So that goes to your point. They're not incarcerated anymore, but they're still incarcerated.
Yeah, no, it's a social incarceration as opposed to a physical or structural incarceration. Jess.
Okay, I've got another question for our guests. And Sierra, I think, touched on this a little bit earlier about not asking somebody why they were incarcerated, but Isaac wants to know, what would you say to employers who express reluctance to hire someone with a criminal record due to possible liability issues?
Well, I would say, I think the realest answer would be, what's the liability? I mean, we're all liable for something. We can all drop a hammer on somebody's foot or whatever it may be. So why? Like, really question yourself. Why are they considered a liability?
Yeah, I think the thing you have to remember, and I'm not, you guys are the experts, but it's like, if there's a fine line between who is and who isn't in jail, does that fine line still separate them when they're trying to apply for a job, or really is it the same population of people?
Yeah, and it is. It's, like we said, everyone's a person, and once a person's debt to society has been paid, we shouldn't continue to punish them. It's double jeopardy.
So, okay, I'm going to interrupt for 1 second because I've got my own question, Jess. I'm going to ask my own question. So, I'm going to confess that sometimes when I visit with somebody I know that's been incarcerated, I'm just a little more fearful. How do I handle that fear? What do I say to myself to think, Stephen, remember that this is a person, you don't know the whole story, you can't judge them. And yet I think I do. It's
a practice, and it takes. I mean, it's a bias like anything else. And I think you just have to keep practicing. Say those things over and over to yourself, and you'll start to believe it. And you can also start giving back to the community. There's some really great reentry organizations here in Wyandotte County and in Jackson County. The one in Wyandotte County that I know well is the Village Initiative, and they have some really great volunteer opportunities. So just throw yourself in. You could serve as a mentor for someone who's looking for work, returning to prison, returning to community. There are folks who've been incarcerated for 30 years, mean, can you imagine coming back to Kansas City after being gone for 30 years? I mean,
The world's changed.
the world has changed. I
Yes.
mean,
Our football team's actually good now.
I was gonna say, I was like, who's
Patrick Mahomes?
Who's Patrick
Yeah.
Mahomes? Like,
Right.
he wasn't even alive 30 years ago. You wouldn't know what
Good
you were talking
point.
about.
Yeah.
If I may, can I add something
Please.
there? Dr. Stites, I would first think about, like, where does this fear come from? Like, what is your fear?
Yeah,
is
it's
the
just- it's
fear you,
unknown, right?
as a provider, you not being able to treat them the care?
Yeah.
Is it a fear that they won't receive your care? So I think one question that all physicians should ask themselves if they have this same type of bias is like, why? What exactly am I fearful of?
Yeah, I think that's really fair. Jess.
Dr. Stites, I have 2 more questions, and they're both for our guests, but we did get a few COVID questions, so
Okay.
me and Dr. Hawkinson can address those on Friday, so tune in for that.
All right.
Fatima wants to know, what can we do as a community to support these women while they are incarcerated? Is there anything we can do to prepare to welcome them in and to make them feel supported?
Team.
Well, I would like to say, while incarcerated, like think Sierra brought up volunteer opportunities. Those opportunities are also in the jails. They want books. They want, one thing that we really pride ourselves on is going into the jail and just being nice to the women, having conversations with them they're not normally able to have with correctional officers, for example. So even any kind of program where you can go into the jail and just say, hey, let's talk. Let's sit here at the table and talk about this. I think those are good opportunities. Like the jail administration, at least here in our local jail systems, they've been pretty receptive to us just coming in and just asking questions.
Another thing that you could do is register folks to vote. When you're, I think, now correct me if I'm wrong, Joy, while you're in jail, you can vote.
Yes.
Um,
Thank you for bringing that up,
You
Sierra.
can vote while you're in jail?
Yes. So a lot of people don't know this. Usually when people are incarcerated in jail, they're awaiting a sentence. They're awaiting a trial. And until you get a sentence to a prison, you're eligible. So it just takes for people like us, people like you, Dr. Stites and Dr. Hawkinson, to say, hey, here's how you can get an absentee ballot. Your vote still matters. And then also, while we're talking about voting, one thing that Kansas and Missouri have gotten right is the fact that as soon as you're finished with your prison sentence, if you're a felon, whatever, as soon as you're finished, you complete your parole and you complete your any sentence in post incarceration, so probation, parole, whatever it may be, you're immediately eligible to re-register to vote. There's no waiting period here in Kansas and Missouri. So a lot of people don't know that, and I think that's worth sharing. That's some good information to share with people while incarcerated.
get out the vote.
Get out and vote. I love that. All right. Jess.
So Jen has a question. So Sierra, when you said don't ask someone why they've been incarcerated, it makes sense, but I think just our human curiosity feels like we just want to know, or we feel we have some right to know, but I think you've taught us something here today. So how do you approach that question, or do you not, and wait for them to share more of their story with you on their own time?
I think you're right. You just wait for someone to share their story in their own time. It's sort of like what my dad was saying, you don't want to give yourself more reason to fear. And sometimes if you find out someone's reason for incarceration or you ask, that can further cement those biases or further give you reason to doubt or fear somebody. And it's just better not to know. And as you develop a relationship with somebody and then they choose to share their story with you, you're in a better position to accept that in your heart and know what to do with that information. But in the meantime, there's never a reason to know, especially as a provider.
I think if you're in a relationship with like when we see a patient, we can ask them questions, but that's a doctor-patient relationship, and there's groundwork for that. But when you're talking to somebody who's been incarcerated or other aspects of their life, it's not you can't really go out and be quizzical until people really are ready to share about that. And I think that we probably ought to look at this just as we have to respect confidentiality and personal privacy in this aspect, just like any other part of their life. Jess, is there another question?
No, just a couple of comments about the family here this morning. Kathy and Jan, everyone really appreciating this topic this morning, by the way. And Dr. Stites, Georgianne says you must have really raised, you and Mom must have done a really good job raising her.
Well, at least my wife may have. I may have been derelict. Who knows? But it is. She's a pretty special kid. I've got 3 very special children. It's a great thing in the world. Having me close at home, that's even better, actually. So, all right, let's get some final thoughts from our guests. Sierra, I'm going to start with you. Live long and prosper.
Live long and prosper. You know, I was thinking about that today, and I'm going to go Star Wars. I know we're definitely more of a Star Trek family, but Star Wars. So in Star Wars, they say only a Sith deals in absolutes. And when you think about incarceration and you think about the path leading up to and during and after, there's no absolutes. And you just have to give a lot of grace, both to yourself and to the person in front of you. And really just think about what are the things that tie us together? What are the ties that bind? Because there's so much more common humanity between us than there are things that separate us.
I love that. I want to come back to that in just a minute. Joy, final thoughts.
I would just like to say, whatever your area is, if you're a clinician, if you're a social worker, just see the person first. Just know their name first. That's it. Just start there. Let's not worry about all of the extra stuff. Just Dr. Stites. Hi, Dr. Stites. Hi, Sierra. And that's it.
I love it. Doc Cock, final thoughts.
Yeah, I think, after this, I think I'm going to put in my resignation and try to co-star with the other Stites' show from now on. So I think it's going to be a lot better.
Yeah, well, I'm not going to set a high bar here.
But all joking aside, I think these messages were great. What does it come down to? I think, one word, obviously there were a lot of messages here. One word, compassion. And in this time of so much division for different reasons, medical, political, other news, just so much division and animosity there. The one word we have is compassion, and I think we need to continue to look at people through that lens of compassion and just understand, try to understand where have they come from, what are their circumstances, rather than the judging that we have heard talk about here. So I appreciate our guests. Thank you very much.
I'm reminded that earlier in the COVID journey in our broadcast, we talked about how faith, hope, and science. Whoa, my mic fell off. No! I had this brilliant little thing I was going to say at the very end. Okay, well, then yeah, well. Here. I think I know. Brilliant thing I was going to say today about, historically in the midst of COVID, we've talked a lot about the intersection and how of faith, hope, and science, and how together, when you wrap them together, you had the ability to make it through COVID. I think when you spoke a few minutes ago about those things that help keep us together as society, I think it's faith, hope, and now love, right? And what is it Lin-Manuel Miranda said? And love is love is love is love. And if you can treat people with faith, hope, and love, the faith that really we have a common humanity, the hope that you want someone to be able to get better in their lives, and their love with the ability to show them grace, which is unmerited positive regard. Gosh, isn't that a powerful way to try and heal people who have been deeply wounded? So thanks to you guys. You've done a great job. So appreciate all of you and to this message today. Jess, what do we got coming up tomorrow?
All right, well, tomorrow, kids 5 and older have been able to get the COVID vaccine for about 9 months now. We're going to take a look back at 3 of the first to get theirs, and they did it right here in our studio. It was a big day back then. We'll be back live Friday at 8 a.m., so go out and make it a great day. Making sure all newborns are healthy.
Get set up for a poke.
The screening program making sure newborns get the care they need. And the extra tests your babies get in Kansas, Friday at 8 on these social media channels.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.